Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Millicent Rovelo, and I'm here with my most energized and bubbly co-host, Dr. Jay Calvert.
Feeling bubbly.
How are you?
I'm good. I'm really good. This is a big day, great topic. Happy to be here with you to discuss breast reductions.
Breast reductions.
But not just breast reductions.
But not just any old breast reductions. Specifically, breast reductions in the teenage patient. So this is actually a very common surgery that is discussed, talked about, kicked up about amongst families and friends, and eventually they get to my office, and then we talk some more about it, and then we do a fair amount of them. But it's not actually talked about that much out in the public sector. So I wanted to shine some light on the subject.
Yeah, I mean, I think, there's a lot of misinformation and misunderstanding about when teenagers can get breast reductions. I think there's a lot of concern, and then there's also the, we don't talk about that, so like blowing this out so that the teenager who's thinking, hey, this might be something I need to do, or the parents that are thinking like, maybe it's time. Like that's important to know, to know what your options are. And because, when, you're saddled with breasts that are, hurting your neck, hurting your back, that are too big for athletics, that cause problems, obviously men do not understand this problem at all. So, but this is a very, very strictly an important female issue that, something can be done, and it can be done safely, effectively. And I got to say it, breast reduction patients are some of the happiest patients in plastic surgery.
Yeah, absolutely. And I will say in my experience, it usually actually does originate with the teenager herself, who then sort of is doing her own research. She's doing her social media thing, and then she sort of brings it up to her mom, and then the mom brings it up to the dad, and then it turns into a thing. But usually it comes actually from the teenager herself. But let's just back up a little bit and talk about breast development in young women. So we are seeing women developing breasts and going through puberty at a lot earlier ages than we used to historically. I blame hormones, don't quote me on that, and the food that we eat. But we are seeing young girls go through puberty and breast reduction or breast development 8, 9, 10 years old. Usually most young girls, young women have stopped breast development around age 14, 15 or so. There are some girls that are late bloomers, but the ones that tend to develop large breasts tend to develop them early, and they sort of plateau between 14 and 16 years old. That being said, your breasts can still grow up into your late teenage years, but to a lesser degree. And then certainly breasts can grow at any time in your life with things like weight gain, changes in hormones. So if you're starting birth control, having pregnancy, childbirth, breastfeeding, and menopause, all these things can cause hormone changes, weight changes that can affect the size of the breast. But overall, if you're looking sort of just at it from a developmental angle, most of the breasts have developed to about 90% of their final size by the ages of 14 to 16 years old.
Yeah, this is and I remember in my residency that, and I think I've mentioned this on this podcast before, that we had a patient that had a breast reduction at 13, 17, and then again at 19.
But that is not common. Let's just put that out there.
It's not common, but they can grow, and typically when you do a reduction, it's one and done. That's the truth.
But there is a small segment of patients that just have recurrent gigantomastia. But that is a teensy tiny sector of most patients. And these patients come in with the exact same complaints that my older breast reduction patients come in with. They come in with the symptoms like you referenced. The neck,
Yes.
shoulder, back pain. A lot of these girls are in sports and they want to be able to play volleyball or water polo. And they do, and they do it well, but it's a struggle because they're constantly having to deal with the weight of these breasts. And then not necessarily uniquely, but perhaps disproportionately so, these young girls are also dealing with the quote-unquote stigma of having large breasts in high school, amongst their teenage peers, amongst teenage boys. Like, it's a whole thing, so they're self-conscious and never want anyone to look at them. It's like, it changes what kind of clothes they can wear. So there's definitely a huge self-esteem and self-confidence thing that's happening in these young girls too. And so these are the reasons are the same as in older patients, but the younger teenage girls are experiencing them too. And as we know, they're quite social media savvy, so they are going online and they're looking, and they're frequently coming to me with girls that have posted their own stories on Instagram or whatever, TikTok. They're like, this girl did it and I want to do it too. So then they go to their parents and their parents freak out because like, my baby wants to have surgery. And then I have to have the same conversation again with the parents, which is that here's what I say. As long as the breasts have mostly completed development, there is no right or wrong age to have this surgery,
Right.
as long as the patient herself has the maturity to understand what she's doing and be able to deal with the post-op surgical needs that she's going to have. And in some girls, that's 15, sometimes it's 19. But as long as they are mature enough to handle it and can understand what they're doing and their breasts have more or less stopped growing, it doesn't matter if they're 15, 19, 21, they're a candidate for breast reduction.
Yeah, and you can see this, it's just like with my rhinoplasty practice. This is a physical, deformity to themselves. It's not obviously a deformity to have breasts that are larger. That's very normal, and it's totally within and some of them, it's just something that the patient does not want to deal with, and they are tired of being, having problems with athletics, having problems with, clothing fitting, which is an issue. The, teenage boys and large breasts, like, is this a good combination? Like,
No.
awesome, right? It's awful. And, I just, not my teenage boys. They're
angels,
They're
I'm
very
sure.
good. They actually are. But they there's a lot, and I see it with the rhinoplasties, and we see it with with the large breasts. This is a social issue that if you can do something about it, it's kind of like if you think about our craniofacial training too, with like with reconstruction of an ear for somebody that has what's called microtia, where an absence of an ear. Well, if you can fix it before they go to school, like, that's great. Then they don't have to sit there and take the ridicule of
Right.
not having an ear.
Right.
Right.
And the trauma that causes.
100%. And so, obviously the larger breasts don't show up until puberty. So, like, this is a problem that can begin as early as, 10, 11 years old. And, you can deal with it at that time. I mean, the surgery is very safe.
I wouldn't say we should do surgery on 10 and 11-year-olds.
No.
Let's not do that.
No, I didn't say that. I'm saying it starts at that time. And then I think the earliest that I remember doing surgery was on a 13-year-old. But it was needed.
Yeah, if you're 13 years old and you're like a tiny girl with large breasts, like, that is a recipe for lots of problems.
Yes.
And that is someone that I probably would advise you may need another surgery, in a few more years. And that is the question I get. And I say, yeah, we'll do this surgery now, but just so you know, there is a chance you may need one down the road. But you know what? If we can get you through your last 2 years of high school and college feeling comfortable and confident in your body,
100%.
doing the sports that you want to do, like, that's a win. Why would you want to put that off for another 4, 8 years when you could be enjoying all the benefits of it now? And I will tell you that these patients are also similarly just as satisfied as my adult breast reduction patients. I've never had a single one of them come back and say they regretted doing it. If anything, like most patients, they wished they were a little bit smaller. So they are over the moon. They can put on their swimsuits and go to swim practice. They can do their sports. They can wear whatever clothes they want. I had one girl, she was adorable. She had a birthday like a month or two after her surgery, and her friends came over and they brought her all these like bras by Victoria's Secret that she could finally wear because she didn't have to shop at like the granny specialty bra stores. So she just could buy them off the rack. So it's a really big life-changing thing for these patients. And the way it typically works They come in, and if you're trying to go through insurance, it can get a little sticky. Sometimes these patients will meet the requirements for insurance in terms of how much breast tissue we're going to remove and the symptoms that they have. But some insurances have an age cutoff, and they just say, oh, nope, if you're under 18, we won't approve it. So I have come up against that before. And then the parents and the family just have to decide if they want to pay out of pocket for the breast reduction.
Are you trying to get me up on my soapbox?
No, we have decided that we are not going to talk about, and I have decided that I am not going to talk about insurance today.
You see, I started tweaking when you started
because
saying that. I was like,
I literally and actually cannot talk about insurance today without getting very riled up. So I'm just going to say that was my one sentence on insurance. Sometimes they don't cover it.
I know what we should do.
Moving on.
No, I know what we should do. I think we should have like a WWE cage match with like the insurance executives.
And me?
Yeah, and just you. We'll send you in there alone. Like they won't stand a chance. No, this would be carnage for sure. But I mean, it's like the problem with insurance. And I want to talk about it because I'm sorry that I'm gonna hijack this from you, and I know you don't like that, and sorry. But the insurance companies tell us how much tissue that we need to remove based on factors that are fabricated from nothing. Oh, what's the patient's BMI? What's the cup size of the breasts? Send us some photos.
Right. Have they done physical therapy for 2 months?
Right.
Physical therapy to help their large breasts? Yeah, okay, that's not helpful.
And then they'll say, okay, in order for this to be covered, you need to remove 400 grams of breast tissue. And I'm like, what does that have to do with anything? Like, I have to remove 400 grams or it's not going to be covered? What if I remove 360? What if I remove, 320? What if I remove 380? It's not covered? Why is that? It's mind-blowing. The idiocracy of the insurers when it comes to telling us what needs to happen so that they'll cover the cost of the procedure. What is that? Do you have an answer for that?
No, just put me in the cage.
Yeah, you're ready.
Put me in, coach.
See? There we go. Cage match. Millicent versus Cigna. Or any of them.
Any of them. Place your bets right now.
Blue Shield of California. Well, in California, we only have 2 options for insurance anyway. So, but I mean, it's bizarre. Like, how can they determine what needs to be done based on fact? Like, have they seen the patient? Did they do an exam? No. And does it matter? No. You need to reduce the breast in a way that you have a viable nipple areolar complex, that it basically gets the breast to be smaller, but also anatomically, the way that we do these reductions, it has to work for the blood supply of the tissue. And then you want it to look great.
You want it to look great. At the end of the day, you want these to look great. I mean,
period.
If anything, like every breast should look amazing, but like especially a teenage girl, like she's going to spend the rest of her life with these breasts. So they have to look really good. And for the most part, they really do. And they're happy and they go about their lives and they don't think about it anymore. And then the question always comes up, like, when is the best time, like, in the year to do this? Because obviously they're students and they're in school. So I definitely do a lot of these in the summer. The typical recovery for these patients, you can have, I say, about a week or so of some pain and discomfort. It's not awful. We can get through it with some pain medications. After a week, they're feeling okay. They're moving around okay, but no heavy lifting, nothing strenuous for a good 6 weeks. So if they're in sports, et cetera, that needs to wait
take that time
for
off,
6
for
weeks.
Sure.
But when they do go back to school, they have to be careful about how much weight they lift with their backpacks and things like that. I had one girl, her friends carried her backpack for her for like a month. It was really cute. So they find ways around that, or just not carrying anything in their backpack. I don't think kids have books these days anyway, so it's less of an issue. They have like one iPad.
Yeah, bring an iPad. They're good.
That's all they need. They don't even need pencils. And they do remarkably well. I had one girl, I did her surgery on a Thursday. She was taking her finals on a Tuesday the following week. Like, they do well. You can do it during the school year, but obviously it's easier and it's more sensible to do it over the Christmas break, Thanksgiving break, summer break if you can.
Well, what about the scars? This is like the big issue that, I mean, never mind in teens, anybody who is having any kind of reduction or lift, the scars of these operations are of concern.
Absolutely. So these scars, they go all the way around the areola, down the center, and underneath. So it's a full anchor scar. Now, that scar that sits underneath, you're not really ever going to see because the breast sits over it. But certainly if the patient's looking at herself in the mirror or someone's looking directly at them, you'll see the scars that go around and down. That being said, these scars do heal pretty well. The months, probably 3 to 6, they kind of go through this ugly, bright red phase where they're very prominent and noticeable. After about 6 months, that redness starts to fade and go away. By 12 months, they're lightening up pretty well. And after a year or two, they usually are pretty unnoticeable unless they've had some severe wound healing issues or something like that.
Or if they get darker pigmentation
Darker
or something, which does happen.
It definitely happens, but I tend to follow my patients pretty closely. So any funky scar issues that come up, we have options for steroid injections, microneedling, laser options. I get them on scar management creams and gels really quickly. So we do follow them pretty closely and make sure that anything that comes up that's not warranted or that we don't like, we have options to treat it. So the scars are sometimes usually harder for the parents, actually the moms, to wrap their heads around than the girls. They seem to be fine with it by the time they've reached this decision. But for the moms, they want to make sure that these scars do heal well, obviously. But yeah, I would say they in general, these patients do really well. They're really happy with their results, and then they move on and they enjoy life.
Yeah, I mean the like I said, I mean I love doing breast reductions. I think it's a very crucial aesthetic operation, and just some of the stuff that I've seen.
Yeah,
boxy.
I know.
Inferior pedicle stuff from days of yore that just, it's like, come on. Like,
I would
put your back into it. Make this work.
Try, really, this is where I think it is important to choose, especially important to choose your breast reduction surgeon very wisely. I have seen young girls that went to just these, I'm going to call them hack surgeons, because what I saw afterwards, like staples and lopsided, and I'm just like, oh my gosh, this poor girl. I can't believe someone did this to her. So definitely make sure that you're comfortable with your surgeon's post-op results. And then for the parents, there's always the question of safety. No parent wants to see their child go through surgery. It's nerve-wracking for them, and they want to know that it's going to be safe and that they're going to have their daughter delivered back to them safely. And I would say if your daughter is otherwise healthy, you're going to a board-certified plastic surgeon. They're using a certified
facility,
surgery center or hospital, and you have a qualified anesthesiologist or nurse anesthetist taking care of them. These patients do great from an actual surgery standpoint. There are always the risk of complications in these patients. It's usually really minor. Every once in a blue moon, maybe there's a bleeding issue, not life-threatening. There's no major blood vessels in the breast. They're not going to bleed to death. But if enough blood accumulates, you'll have to pop a few sutures, wash it out, make sure it's nice and clean. Infection happens every once in a while, but not uncommonly. Most commonly, you'll see wound healing complications, and those are easily manageable with some local wound care. And then changes in sensation to the nipples and the breasts themselves. Usually it's temporary, but sometimes long-lasting decreased sensation is possible. And then blood supply, like you mentioned, to the nipples. We try our best to preserve it. If you lose or you get compromised blood supply, sometimes you can have patchy, unusual, but possible full loss of the whole nipple areolar complex. I've seen it one time.
Never happened to me, but I've seen it.
But it was in a much, much older patient that was actively smoking. But in general, the nipples and areolars, they heal okay. Breastfeeding. That's also the question I always get. Are you able to breastfeed after surgery?
I want to jump back on something you said before you get to the breastfeeding, because I think it's really important. You said board-certified plastic surgeon who operates in an accredited facility. First of all, I want to congratulate our team at Roxbury Clinic and Surgery Center, because we just inspected our brandy new OR, and the inspection went swimmingly.
We are a certified facility.
We had like 3 corrective actions, which was like, put a sign here that says that this is a surgery center. It's like, okay.
We can do that.
Yeah, I mean, but I was like, but what about the new OR? Did you look at it? They're like, Yeah, it's awesome.
Yeah, it was fine.
It's great. I was like, but we just built it. Did you kind of? It's amazing. Yeah, it's great. We love it.
Yeah, it's great.
Congratulations.
Just put up a
Can you
sign.
put a sign over here? We need a sign that, that says this is the surgery center on this door here. We're like, that's it.
Okay.
So anyway, but you said that because I wanted to make it clear that if you are a board certified plastic surgeon, every year we sign something that is it every year, every 3 years. So there's some amount of time where you get a letter from the board that says you are operating in accredited facilities. They confirm that.
Right. If you are a board certified plastic surgeon by the American Board of Plastic Surgery,
Right.
then you have to attest every so often that you operate either in a hospital or in a certified
Yes.
surgery center. And they want to make sure that you're not operating in some uncertified garage, hack office place.
And
so if you
I
are
think it's
going
really important.
to a board certified plastic surgeon, that's kind of assumed.
Right.
It's sort of built into our certification that you are operating within a facility. And those of us that are board certified, we want to operate in a certified facility because we can. You know who can't operate in certified facilities and hospitals? Not necessarily non-board certified, but non-credentialed surgeons, those that have not done the proper training to actually be a plastic surgeon. There are plenty of surgeons out there, a little bit of a tangent, that are board eligible. That means they did all of the requirements, they completed a plastic surgery residency, and they're just waiting to receive their board certification. But they are completely qualified and competent surgeons. They are board eligible. There's a whole host of other surgeons out there that didn't do a plastic surgery residency, and they don't have privileges at hospitals. They don't have privileges at certified facilities. Those are the ones you'd want to be more suspicious of.
Right, because we can't, in our facility, you have to have privileges to do the operations in our surgery center that you also have in a hospital.
Mm-hmm.
So like Cedars-Sinai signs off on you and I to do like...
Oh, they don't sign off. They make you go through like a 6-month
exactly.
period of like applications and accreditations. And can you get a letter from your second grade teacher kind of
It
process.
is. It's really a big deal because they want to know, are you certified to do these things? So then the hospital gives you privileges, and then in order to do those procedures in our surgery center on Roxbury Drive in Beverly Hills, which is accredited by Quad ASF and now by a federal inspection by Medicare, we've upped our ante. That's why we need the new sign, and which I didn't know about, which is fine. We'll get the sign. But now you can have those privileges because you're able to do it. The hospital board has signed off. You can do that in the surgery center. Yeah. So if you don't have, and people always say, well, how do I know that my surgeon's certified? It's simple. Where do you have hospital privileges? Do you have privileges to do this in your surgery center? So breast reductions are one of those things where it is not a simple operation. It seems so simple. It's like we're going to just take away breast tissue and close these incisions. But doing it so that it heals well and it's beautiful and you retain nipple sensation and nipple viability and it looks nice, all those things are not simple.
It's complex.
It is. It's very complex. And I just, I think that social media has kind of dumbed down these procedures where people are like, oh, you just do this or just do that. And, there's all these, like people will... and this is not board certified plastic surgeons, but they'll literally meet their patients in the pre-op holding area to go to surgery for the first time, and it drives me crazy.
I can't stand that, yeah.
So anyway, back to the reductions.
Back to the reductions.
That's my soapbox tangent for the day.
Hey, you know what? I don't hate it, so I'm okay with that.
Yeah, because that's because you did all the stuff, and so did I, and it just is hard because the public doesn't have, they're just not privy to the information.
Well, that's why we are here today, and we're putting it out there that these reductions can be done in young women. They can be done safely. They are a game changer. They are a life changer. And if your young daughter is coming to you and talking to you seriously about it, and you know your daughter and you think that she is responsible, mature enough to handle this, and she's doing it for all the right reasons, then there is absolutely no reason to get her in for a consult and let us evaluate her and see if, in fact, she is a good candidate.
I think, yeah. And we've done a previous podcast, I think, on post-op care for breast reductions. Like, we don't want to get into all that today. I think
if not, we will put out a new one.
We will need that.
For the moms and the daughters.
All right. Well, I dig it. I think that's very good.
Good. Is there anything else you want to add, Doctor?
No, I just think, I think that this is a really, it's such an important decision. I mean, I think surgery, any operation that we're doing is a life event. You know, it is. It's going to be something that it shapes the rest of your life, not just from a physical standpoint, but it's a choice. It's such a growing moment. In reductions, it's to anti-grow, I guess. But
It's a shrinking
it's a
moment.
personal, it's a personal growth moment. And I don't think people should take it lightly. And I think that, not only should you understand who's operating on you, but you should be in communication on what the result that you can expect. And then what happens if things don't go exactly right? Because in surgery, that happens. And,
No guarantees.
we always say it, that if you're not having complications in surgery, you're not doing any surgery, because they do happen. And there are always problems. There are always things that you have to take care of. People heal differently. And it's not, it's not the end of the world, and it's not but you want to make sure that you have somebody that can really get you over the line the right way and get you the best result and deal with problems that do come up. So
Absolutely.
that I do want to add.
Fantastic. Well, I think that's it. Obviously, if anybody else has any questions or concerns, please feel free to always reach out to us. We're happy to take any questions or comments. Otherwise, this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.